All right, ladies, let's lock in. Welcome to She Knows DNA. My name is Mia Vanna, and I am a board-certified genetic counselor. Being in this field, and more specifically the prenatal specialty, really puts things in perspective as far as how not only being pregnant, but delivering a healthy, alive baby, how that is such a miracle. However, unfortunately, and especially on my timeline, I continuously see women, more specifically Black women, who are having such a hard time getting pregnant. And that can be very strange because generations ago, that was not true. You know, like people was having many kids, okay? Like my great grandmother, my big mama, she popped out 10 of them back to back and it was nothing. Meaning there had to have been some type of change or exposure or whatever that is preventing us from popping out babies, let alone just getting pregnant in the first place. There are a number of factors that is attributing to why it's so hard for Black women to get pregnant. One of them, though, we will discuss today. So with that being said, let's get into it. Let's talk about uterine fibroids. Uterine fibroids, also known as leiomyomas or myomas, are benign tumors arising from the uncontrolled overgrowth of smooth muscle and connective tissue in the uterus. These fibroids are the most common types of benign tumors that can affect the female reproductive system. It states that by the age of 50, about 70 to 80% of all women will have either currently or have had in the past fibroids. Right now, the age that it is spiking in numbers is between 30 years old and 50. When we say the female reproductive system, especially in this case, remember a woman should be born with 2 ovaries, left and right. Then they'll both have fallopian tubes that lead to the uterus. Uterus is where a fertilized egg will embed itself in order to start growing to make a baby. Now, they say that there are a good number of people that are asymptomatic whenever they do have these fibroids. However, on the flip side, there are those that probably need to get checked out to see if they have them because they have absolutely horrible menstrual cycles, lots of pain, lots of fatigue, the bleeding during the menstrual cycle is very heavy. This can cause complications as far as infertility or even just in general pregnancy loss or having a hard time getting pregnant. As far as how or why a woman gets uterine fibroids, there are many reasons, but if I'm talking about it on this page, then you already know that means it must have a genetic component. There are hundreds of genes that's associated with the formation of uterine fibroids. Now, the names of these genes truly don't matter, but what does matter is what do these genes code for? Those genes seem to all somehow be related to those that affect cancers or can cause cancer, those that have or try to protect from DNA damage and even cell damage. There are those that aid in cell death, or even really the health and survival of a cell. There are some of those genes that help with the detoxification of our body, so that is releasing the toxins rather than them getting built up. And really a number of others, especially those that can cause disease to the reproductive system. Hence is why we're talking about fibroids. Do you need to get genetic testing in order to prove that you have fibroids? No, but what these research it helps with is whenever we're talking about maybe even trying to find a cure or some type of solution in order for them not to be as prevalent or for them not to grow back. And that is through really things like gene therapy and gene editing, where there are these devices that we can go into the DNA and literally correct it, or more so introduce more healthy cells, and that way that can reduce, possibly even eliminate the genetic mutations that come with having fibroids. Another factor when it comes to genetics is talking about, is it inherited? Well, even though there is not a set percentage as far as, oh, if I have fibroids, so what's the percentage that my baby will? However, they do see that it is stronger when it is passed down through the mom's side compared to the dad. Another factor, even genetic factor, is talking about which race is most likely to be affected. And you already know what that answer is. Black women are more likely to be affected. There are some reports that stated 80 to 90% of all Black women will have fibroids at some point of their lives. Then when it talks about the onset, or when do they start seeing these fibroids, and that age was around 18 to 30 years old. Then if we back up a little, remember I said the general population, that usually happens between 30 years and 50 years, but that means, especially according to these statistics, is that Black women will develop fibroids way earlier than any other race. One thing I find very interesting is that whenever you look at potential risk factors that causes you to have an increased risk of having fibroids, baby, they all relate to Black women. Look at this with me. Those that start their period early, check. As a matter of fact, I did a video on that about how Black girls, we are more likely to start our period at younger ages. Next, there is stress. Check, 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 check. Lots of checks there. And then there's vitamin D deficiency. For whatever reason, we are deficient in our vitamin D. Check. Last but not least, it says obesity. Now, I want to say check, right? But also I feel like for us Black women, it's really just our thickness. We are thick. You know? And so are we really obese? Or are we curvy? Thick, right? So isn't that interesting? So testing that they do in order to see if you do have fibroids, that can be done through an ultrasound or things like an MRI. What they do with that is it really kind of depends on the person and the size and like your personal wants. Because how this affects fertility is that, yes, there's this uterus, but remember this tumor is embedded in the wall of the uterus. And so in order for that fertilized egg to implant and then start growing into a baby, it can't do that on the fibroid. That'll lead to literally miscarriage and all the things, or really you not being able to get pregnant in general. So that's part of it. And then there can be complications during the surgery, because what if things go wrong and they have to take your whole uterus, or really your entire reproductive system? We're talking all the ovaries, the fallopian tubes, and the uterus. And then too, again, they whenever you do get those surgeries to pull them out, especially if you really need them, then that leads to scar tissue, which again, we can't have a fertilized embryo implant on scar tissue. So it's just all over the place. And also too, this is why, like, if you're young like me, I'm 29 and I do have fibroids, while your OB says, okay, or not your OB, I'm so sorry, my gynecologist, not OB, I'm not pregnant. But she states, like, if you want to have kids, I suggest you do it now rather than later, because my risk associated with my fibroids will increase. Joke's on her, I don't have a man. No potentials, no roster. Who I'm gonna have this baby with? You said soon. What's soon? Let me know. And then if that is, which that, yes, was her medical recommendation, send me potentials. If you want me to have kids, which I do want to have kids, that means that y'all need to send me my husband. We get married and then I think that was TMI. Long story short, really, this is one of those other conditions that you got to advocate for yourself. We got to push some of these medical professionals to screen to help us rather than just let us suffer for years and years and years. And so I hope that really helps. And now to leave you with words of wisdom. Chad, I have been traveling, okay? I recently left the Bahamas not that long ago, but our port was at Miami, Florida. And so my words of wisdom is stop getting them BBLs. Everybody around me had a BBL. And it was obvious. Some of them, I said, no, that has to be a BBL on some type of fluid drainage malformation that's not working, because they didn't go get their lymphatic massages after the BBL, and now it's looking like that. There were some good ones, but they were just everywhere. Just say that. And so, again, that is my words of wisdom. And guess what? There's even a song to kind of describe the things that I mean. Listen to this. These BBLs killing y'all. And the thighs don't match. Well. Take heed, saints. Amen. Amen. Well, that's all I have for you. Thank you so much for continuing to support She Knows DNA. Please feel free to like, comment, subscribe, all the things. If you have a recommendation for a topic I should do, please let me know. And also, don't worry, my partner behind me, see, Deuce is asleep. Oh, it's a hard time being Deuce. He's just needed in so many avenues. But don't worry, my baby dog is here. All right. Thank y'all again, and I hope and pray that y'all have a great rest of your week. I'll see y'all next Tuesday. God bless you. See you later.